Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
So our topic today is pediatric home care, sending kids home safely and reducing readmissions. My guest is Andrea Toomay. She is a registered nurse and the interim director of Children's Mercy Home Care. Andrea, welcome to the show.
Thank you.
So let's just start off. I know, obviously you spend a lot of time working in the home care services, and so I just kind of want to hear from your own experiences why you think home care services are so important.
Yeah, well, of course. Home care services are so important to the children in our community because children really heal the best at home in their own environment. They're there with the people that love them the most. And so we have found that bringing the children back to their home where they're comfortable, where they're able to heal the best, makes for the best outcome for them.
Yeah, I mean, I think it's true, and I think most physicians and nurses would agree, whether children or adults, the faster we get people out of the hospital, the better, right?
Absolutely.
But then, of course, we got to make sure that we're doing the appropriate thing for them in the home setting, and that's why I think the work that you do is so important. So when there's an inpatient, when there's a child admitted to the hospital, at what point does your team start to engage with the family and the patient to prepare them to go home?
Sure. So typically, it varies on when we are notified that the patient might need home health services. We do have a hospital liaison that is based in our main campus hospital, and she is there to answer any questions and kind of help service. And she really is our true first base of home care to those patients and their families. And what happens is the care managers at the hospital typically contact her, or they'll contact our intake desk at the home care office, and that starts the referral process. So we know that we are going to be asked to be involved with this patient and the family. Our hospital liaison will then go into the room, introduce herself, and tell the family about the home care services that we'll provide. And then we start checking insurance authorization and things like that to make sure that the visits will be covered for the family. So it truly starts as they're in the hospital. We start teaching. We start prepping them for what we will do for them at home.
So besides the liaison, how many other people and what other professionals are part of the home care team?
Sure. So, like I said, we do have an intake desk that are fully staffed with registered nurses. So when a referral comes into the intake desk, we're able to speak clinically to those folks about what the needs are for that specific patient. We also have therapy staff, which is the OT-PT, speech therapist, and then a social worker. We have several registered nurses on staff, and most of them have pediatric certifications as well. And we do have a line of DME, which is durable medical equipment. Those are things such as formulas, NG tubes, feeding tubes. We also have pharmacy services. So any patient that would need to go home on IV antibiotics, TPN, lipids, those types of things, we're able to service those needs as well.
Well, let's talk a little bit more about the services you provide a little more specifically. Because you kind of touched on a few things there. So what exactly are the services that your home care team is going to provide?
Sure. So the skilled nursing in the home, which would be the direct care to the patient, we really try to teach the family how to do self-care. So the nurses in the home doing a lot of education, for example, how to put down an NG tube, change a G tube, change an infusion pump, and bag and medications and things like that. A lot of times the patient will need a full service care. So we would add a physical therapy, we would add occupational therapy, speech pathology. We also have the social worker, like I said, and that really, the social worker helps with the family and our nursing staff and our therapy staff as a whole. She's looking at the entire picture of the home environment and how to help get community resources plugged into these families who, are having a hard time bringing their child home. It's not something that's normally planned. And so she really does a good job of just helping them transition to their new normal.
How many children are we talking about here that require home care services?
It's a wide variety. We have hundreds of patients on staff that require the durable medical equipment, about the same for the home health services as well at any given time. So it's a wide variety, and we do, just talking about the service area, we go out 55 miles from our main hospital location. So we service Missouri and Kansas, and we catch a wide variety of kids within that area.
Yeah, I wonder, I guess, with the recognition, as we said at the beginning of the discussion, Andrea, that obviously we recognize now the faster we get people out of the hospital, the better, right?
Yes.
So obviously home care services is something that's going to need to expand. How do you see the role of your team working in the future? Are there plans to expand, to add staff? What is Children's Mercy planning on doing to support home care services?
Yeah, absolutely. We are planning to hire several more nurses and actually several more therapy staff as well. So we will over double our PT and OT staff as well as our nursing staff. We do have plans to hire, they're called admission nurses, and they will cover some of those weekend admissions that are heavily being requested that we do that as well. So yes, we are going to be expanding, and we have the hospital support to do that.
So, but on the flip side of all this, so yes, we want children to leave the hospital, as soon as they can, right? But on the flip side of that, we don't want them to come back, right? And so that's really another one of the goals of your department is reducing the readmissions. How is that going?
Yes, so you're exactly right, and that's why we focus on self-care, and that really means the family is learning how to care for their child at home. So, our nurses and our therapy staff go in, and they're normally there about an hour and a half at any given day of the week, whenever their visit is. So really the family is left in charge all the other hours of the day. So our focus and our goal is to make sure the family really feels comfortable taking care of that kiddo, and that's what keeps them out of the hospital. Changing a wound dressing, or doing the infusion and making sure that is the cleanest way to do it so they don't get infected. Those are the skills, the very good skills of our nursing staff. And they explain these are the reasons why you do this, to keep the kids out of the hospital. And so we are seeing a big difference.
Yeah. Well, that's great. I'm really excited for the work that you're doing, and I'm excited to see the home care services expand. Obviously, it's so needed, and it's so critical just to the overall health of our kids and our community. So, Andrea, thank you for the work that you're doing, and thanks for coming on the show today. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.